Good evening, my friends, colleagues, and all the patients. As we know, we are aware of the fact that nowadays one of the largest mortality factors in day to day in our country as well as world is cardiovascular disease. Apart from the other disease, one of the major mortality is caused by cardiovascular death. Almost 40 to 45% death in our country, particularly in lower age group like 40 to 50 years of age, occurs due to cardiovascular accident or what we call heart attack or failure, whatever it may be. It causes due to ischemic heart disease and myocardial infarct, resulting in major morbidity as well as mortality. It increases as the age advances as well as others comorbid factors, diabetes in particular, and other disease like hyperlipidemia and such. Today our purpose of this presentation is to make aware and to answer a few questions that comes up in day to day in the patient's mind as of now. As we discussed a few minutes earlier, heart attack is the myocardial infarction caused by arteriolar block in the coronary artery, which results in plaque formation as well as plaque disruption. As a result, there is constriction of the arteries in the coronary arterioles. As a result, there is decreased or less blood supply in the myocardium, resulting in heart attack. That is, we called myocardial infarction, resulting in from ischemic heart disease. It is quite bit difficult as far as the typical cardiac chest pain is occurring. The patient should note first of all what is the nature of the pain. Is it constrictive or is it over the precordium centrally placed, or diaphoresis is associated with that and impending wound. First of all, these are the typical signs and symptoms. Besides this, some atypical chest pain, right, shoulder girdle pain as well as radiation in the left upper limb as well as jaw claudication also. So it is better to notify and present to the doctor if anyone is suffering from chest pain, or is it sudden or whatever it may be. It may be dull aching pain also, aggravated by walking and jumping, jolting or exercise. Cardiovascular disease is the continuum of the total metabolic syndrome process. In case of diabetics as well as other dyslipidemic patients as well as hypertensive patients, they suffer from heart attack after a long duration of the events. So it is just the effect. It is not the disease. It is caused by some other comorbid conditions like diabetes, high blood pressure, as well as high chance of familial incidence, as well as high triglyceride or LDL cholesterol, etc. It may happen in such high risk patients, though some cases of sudden cardiac arrest also occurs, though it is quite a bit lesser in number in comparison to the previous one. It is possible in case of the players and athletes also sometimes suffers from heart attack, but usually it does not happen. Healthy persons means the person should have done all the investigations in fewer months ago, but it happens in case of athletes where some of the patients occurring heart attacks and some other comorbid conditions, myocardial infarct as well as dissection of the aorta is one of the major cause in case of coarctation of aorta patients where sudden heart attack followed by death occurs. It happens sometimes. It is possible for a cardiac patient to live a healthy life if the patient obeys all the directions of the doctors, and walking 30 minutes a day is necessary. with healthy lifestyle, cessation of smoking as well as alcohol, and to take high quantity of fibers like vegetables and fruits, etc. And of course, taking the usual medicine at the usual time and obeys the doctor's advice. It is possible for a cardiac patient to live a normal life. A patient, whether he is a cardiac patient or a high risk patient or diabetic patient, whatever it may be, he should maintain a healthy lifestyle, number one. Number two, to stop the smoking, and he should exercise at least 30 minutes a day, not isometric but the isotonic and aerobic exercises, walking, etc. To take high level of vegetable fibers and fruits, and to avoid high stress as well as sleeplessness, and anxiety should not be there in such a way, and taking the appropriate medications at the appropriate time, etc. A patient with cardiac disease may lead a healthy lifestyle like the others who does not have the cardiac disease. Thank you. Thank you for your kind listening. Thank you.